Welcome to the AACS Daily News. As the incidents of COVID-19 have decreased and more of the population have received vaccinations, many restrictions have been lifted. However, there are still some restrictions in place, particularly in healthcare facilities. Like the rest of the state, Sturdy Memorial Hospital has seen a decline in COVID cases, and we recently spoke with a physician to get an update.
Hi, I'm Dr. Brian Patel. I'm the Chief of Emergency Services at Sturdy Memorial Hospital. The CDC recently put out guidelines stating that vaccinated individuals no longer need to wear a mask indoor or outdoors. And while this is great for the public, this does not change anything at Sturdy Hospital or any healthcare facilities. Given the patient population that we take care of, it's still important that we maintain all infection control processes, especially given that we are not going to know clearly whether someone is vaccinated or unvaccinated within the hospital. We are still going to be wearing masks in all public places and whenever we're taking care of patients, and we're going to be asking that patients and visitors also continue to wear masks when they are within the hospital in order to maintain their safety and the safety of our employees and our patients. You will notice that we will continue to have social distancing requirements so that people will still be trying to be 6 feet away as much as possible. We will be limiting visitation as well to minimize crowds and to minimize risk of spreading COVID-19 within our inpatient units. And we will continue our high-touch cleaning, and we'll be cleaning areas frequently to make sure that everything is well sanitized throughout the hospital. I think that people believe that once they're vaccinated that they're completely immune from getting COVID-19, and while the vaccines have an excellent efficacy, almost 95% chance of not getting COVID-19, there's still a small risk of getting COVID-19 even if you are fully vaccinated. And so continuing to be cautious when you are out and about is very important. You do want to make sure that you do try to keep yourself safe, and there is always a risk of getting COVID-19, although it will likely be much less serious. You'll have more minimal symptoms and are much less likely to have to be admitted to a hospital, which is a good thing. Recently, the FDA did approve the use of the Pfizer vaccine for anyone over the age of 12, which means now that school-age children can get vaccinated against COVID-19, which is a great accomplishment for us to be able to vaccinate even more people within the country. The indications for getting the Pfizer vaccine for that age group are unchanged and are the same as any other person that would get the Pfizer vaccine. And the only contraindication to getting the vaccine in the adolescent population or the adult population is having a true anaphylaxis or allergic reaction to any component of the Pfizer vaccine. So really there's no difference in any indication for getting the vaccine in the ages 12 to 18 versus the adult population. So right now, they are currently doing studies looking at the safety and efficacy of both the Pfizer and Moderna vaccines in ages 6 months to 12 years of age. And those studies are currently in progress right now. And so we're hoping that we should have some results on that sometime in the late summer or early fall, and are hoping to be able to get approval to be able to use the vaccine in that age group in the fall or winter time. But it all remains to be seen how well the studies go over the summer. I think that especially in the unvaccinated population, it remains critical to wear masks. We know that masking truly protects people against getting COVID-19 and decreases your risk of getting COVID-19. And when you're out, especially in an indoor setting, you likely won't know whether someone around you is vaccinated or unvaccinated. And so especially if you're not vaccinated or if you have some underlying disease that puts you at higher risk for getting COVID-19, I think it remains important that you do continue to wear masks, practice social distancing, and practice good hand hygiene in order to protect yourself. So thankfully, locally and at the state, the incidence of COVID-19, both the numbers of people with COVID-19 and hospitalizations and deaths related to COVID-19 have decreased dramatically, which is why Governor Baker has felt comfortable reopening Massachusetts in the next week. At Sturdy, that also remains true. We have very low numbers of COVID-19 in the hospital right now. Less than 5 patients a day on average are in the hospital with COVID-19, and we have not had any recent COVID-related deaths within the hospital and currently have no patients in the intensive care unit with COVID-19. We're lucky in the United States right now that COVID-19 has decreased so dramatically, in part to the amount of vaccination that's been occurring across the country. But unfortunately, worldwide, that is not necessarily true. And we all know that COVID-19 right now is ravaging India with significantly high numbers and significant deaths throughout the entire country. And there are numerous organizations right now that are providing support to India, and I would encourage people that are able to or have the means to donate to those organizations. Things like Doctors Without Borders, the American Indian Foundation are just a couple. The Deshpande Foundation are other ones that you can donate to, and they are sending over supplies and resources to India, including oxygen concentrators, human resources to be able to help take care of patients in that country.